Hey guys, my name is Michelle. I'm one of the nurses here at Hillcrest Animal Hospital. I'm going to walk you guys through on how to give your pet sub-Q fluids if you guys need to do this at home. The main reason giving sub-Q fluids to your pet would be that they have renal disease. There's a couple different supplies that you would get from your animal hospital. One is a needle. So we like to use the biggest gauge needle just because it has a bigger hole where fluids can get underneath the skin quicker, so that it's less stress on your pet. We also have our fluid line and then our fluid bag, and of course your pet. Now, when you get this from your animal hospital, they are going to come in these packages that will keep them sterile. You want to keep them in these packages until you're ready to give your pet the sub-Q fluids. Now first, you're going to open up your bag. You can leave these at room temperature. You can also run them under some warm water to make it a little bit warmer, just so it's a little bit more comfortable for your pet when you are giving this at home. Now, your fluid line has a little cap here, which you want to keep this cap on until you're ready to insert it into the IV bag. It also has a little cap on the other end, which you want to keep on until you are ready to place your needle. So you want to keep these caps on because it keeps these tips sterile. This is your fluid bag. All fluid bags come in different sizes. This is a 500 ml bag. They also come in a liter bag also. The most used fluid would be LRS, which is lactated ringers. So this is what lactated ringers bag would look like. You're going to take off the little tip part, and then you take your line, keeping everything sterile, so you do not want to touch any of the gray area or any of this little pointed area. You're going to insert straight into the IV bag. Sometimes you have to do some pressure on it. You don't want to go sideways because you can puncture the side. If you puncture the side, your bag is going to leak, so you'll have to throw this bag out and get a whole new bag. Once you insert your fluid line into your bag, you want to close down your wheel. This does not allow any fluid to run through your line. Now, this fluid line has all air in it. So you want to run your fluids through this line to get all of the air out because you don't want to insert any air underneath your pet's skin. Doing so, you're going to bring it over to a sink, roll up your wheel, and then you can see your fluids going through the line. Once your fluids go through the line and you have no more air bubbles, you want to close down your wheel, come over here, and then you will get your needle ready. You want to open up your needle, take off the little tip, and place your needle on. You would need to tighten it down a little bit just so it would stay on. Now you will take your pet. So where we like to give the fluids is right here above the shoulder blades. This has a lot more looser skin, so it's easier to give. When you are about to give this fluids, I would get some food that your cat or dog really likes, or some treats. Also, having another hand available will also help make this process go a lot easier. You want this process to be fun for your pet. So when you are giving the fluids, you want to make what is called a tent. So you will lift up your skin, and then you have your tent here. If you look on this side, you can see there you're making a little triangle. You're going to put your needle right in that triangle area, which is the sub-Q area. When you are ready, you're going to take your needle cap off. If you look at your needle, there's a little bevel. You want to make sure that bevel side is up. So you will make your tent, put your needle through the skin until you're in the sub-Q area. Then you want the bag to be higher than your patient. Each little notch is 100 mLs. So once you're in the sub-Q layer, you're going to turn your little wheel, and you will start to see the fluids dripping in your little spout here. You can squeeze the bag to make your fluids go a little bit faster, or if they're happy and content, you can just let it free fall on its own. Over time, as you are doing this, you will start to feel and see a little bubble form. That is perfectly fine and normal. Over the next 24 hours, that bubble will disperse and go underneath the sub-Q layer and get absorbed into the body. After you are done, you want to wheel your little wheel all the way down. This stops the fluids running through your line. I like to hold off where the needle was inserted. Sometimes you can see a little bit of fluid leaking out. That's totally normal also. And just shake it a little bit, and then that is how you give sub-Q fluids.